Okay, great. Because I think my record button's at the bottom of my screen on this kind of right center, and it won't let me do it. So, like that little
Yeah, here we go.
gray circle. Oh, it says recording. Great.
Excellent.
You're doing it.
Yep.
Hey, so good afternoon, and I'll go over some stuff with you guys, and a lot of it's going to be sort of general information, but I think it's worth going over, and we'll talk a little bit about that vaccine and kind of where we're going with that. I'll just start from the very beginning. So coronavirus has been really a pretty remarkable challenge, just to say the least. And you can see that we've had we had a pretty significant bump in the summertime, and we had one in the fall, and I mean in the spring also, but it just didn't really show up because we didn't have adequate testing to really characterize it, as you can tell from this mortality bump, right? I mean, that we really had a lot of mortality in the spring, but it wasn't really reflected in our case numbers. Had a big jump in the summertime, had a decline in the fall, and then we had this massive sort of surge throughout the late fall going into the winter. And again, it's not too surprising because one of our persistent shortcomings is holidays. These little inflection points that you see, these little notches tend to sort of seem to correlate with specific holiday events. You can see Memorial Day was here. You can see that 4th of July was here. We were fortunate we didn't see much of a bump on Labor Day, but we had a little bit of a respite here going into the fall. But then when we got into Halloween, had a big bump. After Thanksgiving, had a big bump. And now we're starting to see this big bump after Christmas. And we're almost certainly going to see the most deadly month of the entire pandemic going through January. We have a lot of people who've died. This is our mortality curves, and you can see the number of folks who died in the spring, those who died in the summertime, and then those who are dying now. One of the things that's really kind of neat to make an observation of is the red bars represent long-term care residents, folks in nursing homes and assisted living type locations. You can see how bad it was early on for those guys. And again, it was bad again in the summertime, but it was really more balanced, and actually more people died not in nursing homes. And then that sort of trend is even more accentuated here, where we've done a better job about protecting folks in the nursing home, but more and more folks who live outside of long-term care settings have died. If we look at what the age group of folks who die, it's mostly going to be older folks. And that's one of the things that's really been kind of a challenge, is for young people who are unlikely to have severe illness, or young adults, it's from a personal perspective, it's hard to motivate them to do things that crimp your lifestyle, or maybe undermine your sort of social activities that you would normally partake in. But it does perpetuate the pandemic, and it does work its way up to older folks who are going to die. Now, certainly young folks do die from coronavirus or have severe illnesses. That does certainly happen. And even in young children, you can have a rare death. But if you look at people who are 65 and above, 1 in 10 people who are diagnosed with coronavirus are going to die. That's astounding. It's terrifying. And it does decline over time, over the different age cohorts. As you can see, about 1,000 folks have died between 50 and 64 and on down. So it really clearly does impact proportionately. The mortality rate's much more higher in young folks. There was early suspicion that maybe younger kids didn't spread coronavirus. And I know that's something that you guys are acutely interested in. A lot of kids are asymptomatic, but they can still spread coronavirus. One of the things that's really important to think about as we try to ride out the end of this pandemic, hopefully we're toward the end of it, is that people who are asymptomatic can spread it. Kids can spread it quite easily. And most people who spread coronavirus don't know they have it, whether they're an adult or a child. So you have to operate your day-to-day life assuming that anybody you encounter can have coronavirus. Not that it's, not that our prevention measures are perfect, but if we maintain some space when we can, if we wear a mask, especially both folks, I know little kids, it's tough sometimes. If you wash your hands and have good ventilation, I personally know that I've been around about a half dozen people that I know who were infectious with coronavirus that I was personally around before I was vaccinated, and we maintained some space and wore masks, and I didn't get it. Now, I'm not saying that that's perfect, and maybe, but we do have a sense that, especially within the school settings, that structured environments where people maintain some minimum space and they're both wearing masks is really a very powerful prevention mechanism to prevent the spread of coronavirus. If we look at the the deaths, we can see that it has been more white folks who have died from coronavirus, but African Americans, who only make up 38% of the population, do represent 43.5% of the deaths. So it is disproportionately affecting Black folks. And the per capita one that's the worst is going to be our Native American population. Although it's only about 10,000 folks in the state of Mississippi, 1.8% of the deaths, which is hugely disproportionate. You know, one of the things that's been really funny about this pandemic is we not only have to fight the virus, we have to fight misinformation. We have to fight politics. We have to fight people with an alternative agenda. We have to fight the perceptions that people, because it's scary, people don't want to believe things. And one of the most pernicious of the rumors was that coronavirus didn't lead in an increased number of deaths, that people weren't dying from coronavirus, they were dying with coronavirus. I'm sure you've heard that. Or that people were having a car wreck and they died, and then you're putting coronavirus on the death certificate. There could be nothing more preposterous or crazy than that. That's one of these. I got a bunch of calls about, hey, on the coast, I'd have these legislators and say, hey, I heard a guy who died from a motorcycle wreck and they put COVID on there. I said, oh, that's horrible. Who is it? Well, I saw it on Facebook. And I said, well, if you give me the person you put it on Facebook, and I'll try to see who it is, and I'll make sure that we see if that's true or not. And it was always made up. It was nonsense. Over and over and over again. You know, truth will bear out if you're just patient and try to look at it closely. This will be the deadliest year in Mississippi ever by history. And you can see these are the number of total deaths of people who are dying, COVID or otherwise. And it's sort of, okay, here's our fall peak, remember? Here's our summer peak, right? And now here we're going into our winter peak, and it's going to increase, there's no doubt. We're going to have a lot more dead folks. And then one day, this last week, we had almost 100 people die in a single day from coronavirus. And there's another one I didn't show, but this also pretty much mirrors the number of deaths that have happened to folks who are with coronavirus, but it's a lot steeper and obvious. We have seen, you know, obviously an increased number of people who died with pneumonia. And this is the other thing that's kind of funny, that folks who don't have a good health background will say, well, they didn't die from coronavirus, they died from pneumonia. So it wasn't from coronavirus. And anybody who knows what pneumonia is, pneumonia just means inflammation of the lungs. And what caused the inflammation of the lungs from coronavirus? The coronavirus, right? It's kind of like getting shot and bleeding to death from your heart. And you say, I didn't die from the gunshot wound, I died from heart failure. So I died with gunshot wound, not from gunshot wound. And it's like, come on now, that doesn't make any sense. So anyway, we've had some pretty pernicious and difficult rumors because anyway, you all know why. We've all seen this. As far as our demographic trends, we saw an interesting sort of, we almost have like two separate pandemics. We have a pandemic in the Black community and a pandemic in the white community. And early on, Black folks were affected a lot more seriously. And we didn't really even realize it until we were about a week in. So about right here, and these are CDC weeks. And so it's basically week 1 is January and it kind of goes through the year. We were being told by CDC that, you know, it's going to be people who are traveling from overseas. They're going to come in. Don't worry about people who are living in your community. Just look for travelers. We focused on travelers. And then we started getting some cases and we said, hey, well, let's see what the racial breakdown on this is. And we were like, what? This is crazy. We didn't expect this. And so we figured out pretty early that the Black population was getting hit pretty hard. And we stood up a pretty robust health equity unit to try to make sure that we could messages, communication, prevention measures. We've given millions of masks out to disparity communities and different areas of the state and testing. So we did see a lot more cases and deaths. But then when we got to the summer, we saw an inflection point where Black folks did a lot better than white folks. And that's all prevention. We saw that in general, the Black community did embrace, going into the fall, prevention measures as far as wearing the masks. And then within the school systems, by and large, were a little bit more respective. And we did see a lot of the more predominantly white communities basically thumb their nose to prevention measures, sadly, and we had a lot of cases. And that's not universal. I mean, there's differences everywhere, but on average, that is kind of what happened. We've also seen some dramatic shifts in our populations by age, and if we just look at August, for instance, that's an easy one to look at. It's the red one right here. You can see this is the number of COVID patients for that month by age, and you can see most people who got COVID were around 20. And what happens when you're around 20? You go to college, right? And so we had a lot of people. We had a huge number of cases in high school kids and people in college. But a lot of people don't die in that age group. So the deaths weren't quite so bad at that time. If we go back to August, you can see what's starting to come down as we go into September. But it doesn't stay within an age group, and it kind of moves up the ladder. And right now you can see in November, we haven't done the December ones yet, but you can see that it shifted from young folks to middle age to older folks. And just see how many more we had, and that's invariably going to lead to more hospitalizations and then more deaths. And we talked about the summer and then our fall surge, and this is going to be our average number of cases and then our average number of hospitalizations. And we've seen ongoing increases in hospitalizations, and probably I'm hoping that they're going to stabilize after we get through this sort of holiday surge. It takes a couple of weeks to kind of move through it. That maybe we'll see some stabilization for hospital numbers, but hospitals have been absolutely overwhelmed, and they're overly full. And then if we look at our ICU capacity, you can see that we've kind of pushed up our ICU capacity way more even than we had in the summer when we were so stressed out. I do want to talk about vaccines a little bit. I think this is something that people are really, really interested in right now. There are several vaccine types that are under development. We have vaccines called messenger RNA vaccines, and these are the ones that are currently available that folks are getting now, and I got one of them. I got the Pfizer vaccine. We have viral vector vaccines and a protein-based subunit vaccines. I'll talk about those. And there's some other ones called inactivated or attenuated virus vaccines, and none of those are really being developed in the United States. These are the 6 vaccines that are sort of under production from the Operation Warp Speed group with the federal government. The 2 that are currently available are the Moderna and the Pfizer. And I'm going to talk a little bit about what those are so that you can understand what's going on. The Janssen one is actually, looks like it's pretty close to being approved in the United States, so that one might be available. And basically, it's almost like they took a cold virus and they put a little bit of the genetic material of COVID in there so that you can develop immunity. But I'm going to talk a little bit about Moderna and Pfizer so that you guys can understand what they are and where we're going with these guys. I'm going to go to that and I'm going to come back to it. So what is a messenger RNA vaccine? Basically, what it is it's just a little snippet of ribonucleic acid or the genetic code of the spike protein of the coronavirus. And what it is it basically, the coronavirus has a lot of different proteins, or quite a few. And if we're clever, we can just take one of those proteins and we can put the genetic code of it, just the protein, just that one surface protein that your body recognizes as a foreign invader, not the whole virus. You can't get coronavirus from the vaccine. And we put it in a little ball of fat, and that's called the lipid nanoparticle. Nanoparticle just means small. It doesn't mean robots. I was asked in a public hearing at the Senate downtown did this mean that there were little bitty robots inside the vaccine? I said, no, nano just means small. It's okay. And so it's a little bit of this genetic material of the spike protein surrounded by the ball of fat, and they give it to you. And then your body takes up this material and creates spike protein for your body to recognize. So one of the things that's really cool about this is it lets your body develop immunity to this very important protein, but there's no coronavirus in it. You can't get sick. After the vaccine, you might feel a bit achy just because your immune system's acting up. But it's really, you basically get all the good things about the immune exposure and you avoid the sickness and all the bad stuff. So it's a very elegant design and we're super, super excited about it. My son, who's a med student, came up with a good analogy trying to explain folks how to get a vaccine and why it's important. And his analogy was, just imagine there's a bad guy walking around your house and he wants to break in and kill you, right? And so what if we could give you a picture of the bad guy so that you would know that when the bad guy comes and you could keep him from getting in your house because you knew who he was? As the vaccine is like that. It basically helps your body know who the bad guy is, so that if it tries to break into your body and make you sick, your body can react to it before it has a chance to harm you. And that's how the vaccine will work. If we look at the vaccine development, I want to talk a little bit about the phases, because there have been some concerns that it was kind of rushed. And I would say that rather than rushed, I say it was expedited. It has followed pretty much the same sort of processes that they normally follow. There are numerous phases that are increasing number of people to both look at, does it seem like it's safe and does it work? And then we do a little bit more people. And then we do people from the general population to say, hey, does this work in the general population? And in a normal one, it can take many, many years to get a vaccine. But with the coronavirus vaccines, one that we have, fortunately, there's a couple things that were pretty innovative that have been really, really useful. So you remember I talked about this little vaccine type? Well, people have been working on this vaccine for a decade. So they had all the technology they needed for this little lipid nanoparticle, right? They were actually developing vaccines. So all we needed to do was figure out what genetic material to put in there. So basically, I tell people it's like an 8-track tape, 8-track player. I don't know why I'm using 8-track. Most people don't even remember what those are. And basically, the vaccine vehicle is an 8-track player. And we had the 8-track player already ready, and we just had to get the 8-track cassette to stick into the player to create the vaccine. So this is going to be a neat technology. So in the future, we'll probably be doing this for flu or other stuff too, because it's something that's basically ready-made to make a new vaccine, because all you need to do is figure out the genetic code for the one piece of the virus that generates immunity. So it's going to be real exciting going forward. So we actually had all this part pretty much done when we started, because we had done all this basic science on the mechanism of vaccinating folks. And then instead of doing these phases and then the approval and the manufacturing in sequence, we did them at the same time so that we could save time, right? So once we had a vaccine, basically started making it. Now that's not something that's normally going to happen in a business, because they're afraid they're going to lose money if it doesn't look like it works. But with the Warp Speed initiative, the government basically assumed the risk. So they made the vaccine while they were researching it. And if the vaccine doesn't work out, and some of them haven't worked out, they just toss them, and the company's not out any money. But in this way, once you feel like you have a good one, then you're already sitting on a stockpile of it, and you can go ahead and start getting it out. And that's what's happened with these two vaccines. So I'm going to go back to these just a little bit so that you guys can kind of understand what to expect when it's your turn to get vaccinated, or if you've had it already. The Moderna and the Pfizer are both these mRNA vaccines. They are 2 doses. The Pfizer is 1 dose and then another dose 3 weeks or so later. The Moderna is 1 dose and then another dose 4 or so weeks later. What are the side effects? They haven't really seen any serious side effects in the 30 or 44,000 people. So that's good. And they followed them for some months now. And so most things, that if you're going to have a problem, it'll be within 60 days. So we feel good on the safety piece for that. Not that something rare could not happen, but certainly any potential risk that's going to happen from these vaccines is going to be far less than you actually getting coronavirus. So there is clear advantage to that. But what they did see is that sometimes people would feel achy, like some soreness in the arm after it, or maybe a little fever or muscle aches for a day or so afterwards. And that seemed to be a little bit more common after the second one, when your body, and that's just your immune system sort of ramping up and trying to protect you. Now, I took my 2 doses. My first dose, I sat around for a day waiting to feel bad, and I didn't feel bad at all. I was kind of disappointed, honestly. I was kind of waiting. And then the second time, I said, well, surely, and I got ready, and I made sure that if I got sick, I could cancel my appointments, and I felt fine. Went to the gym, no problem. So I had a real good experience. Some of my colleagues had just a little bit of achiness or something, but it's always really been pretty mild. And I got the Pfizer vaccine. My wife got the Moderna, and my 25-year-old kid, who is a medical student in Washington, D.C., he got the Moderna too. There are some things that people have been worried about as far as like, are there robots in there or tracking stuff? No, that's totally bogus. That is not true. Something Bill Gates said one time about the vaccine, about having a tracking system. The tracking system was basically just a database where you could put your information so that you could, it's almost like, storing your information on the cloud. It has nothing to do with vaccine. It has to do in if people wanted to store their information on the cloud. So it's nothing to do with the vaccine itself. And the other thing is when we do your vaccine, whatever information we have, we do not share it with the federal government. We only give de-identified data. So some people are worried about privacy, and we understand that. The other thing is there was some hiccup about people, like some nutty person said it caused infertility, but that's not true. Not only is there no evidence, there's no mechanism where that's likely to happen. So certainly do not at all think that infertility is remotely a reason. And we do recommend that pregnant women even get it, although would want them to talk to their OB first just to talk about it, because it hasn't been thoroughly studied in pregnant women, but pregnant women have gotten the vaccine and not have problems with it. The only thing that I would advise is if you are eligible to get the vaccine, if you've had severe anaphylaxis. So if you have to carry an EpiPen, we don't recommend you getting the vaccine at a drive-through clinic. You really need to do it at your doctor's office. That's the only thing. So if you have a history of severe anaphylaxis, we'd rather you do it somewhere in a medical setting. So where are we on our vaccinations? You can see that we're off to kind of a slow start, but we've really cranked it up over the past couple of weeks, catapulting us up in the national rankings. A lot of this reason was a couple things, but one of the main reasons was we devoted a lot of our vaccine to the long-term care partnership. So about 90,000 doses, both first and second doses, have been devoted to the pharmacy program, a federal program to give it to long-term care nursing homes. And so basically they sat on the vaccine for a few weeks before they started. So that kind of slowed us down. But now that we've taken over most of the vaccine, we're really cranking it out, both with our private partners here, but also with our drive-through vaccination clinics. And this is some of the information you see by county where we've given a lot of it. A lot of it is really based on population, which, sort of makes sense. Although we do have some areas we want to increase supply. Some of these areas in the eastern, sort of mid-eastern and the eastern part of the state, some of the Delta counties in the Southwest, we need to work on these guys a little bit too. If we look at the distribution by race and ethnicity, we're not doing nearly good enough getting Black folks immunized. Only 15% compared to 63% of white folks. Although a lot of them didn't self-identify, so that we don't really know how that plays into it. But you don't have to put your race to get the vaccine. We've had some people who didn't want to put that on there, but we want it for equity reasons to make sure that we're meeting the needs of all populations. And so this is something that we're working on very, very aggressively to make sure we understand why and make sure that the availability is there for everyone to get the vaccine. And if you look at the total number we've given today, by yesterday, 85,892 doses have been given. Most of them have been given by hospitals, and then we're starting to ramp up our number of doses that we're given for boosters. And then the nursing home partnership is kind of off to a slow start, but we think they're really starting to pick up the pace, give more and more. And then this is just more information on the number of doses that have been given or have been allocated. Most have been given to hospitals. And then we're taking some now because we're going to do all those drive-through clinics this week. We're going to do about, we did about 8,000 last week. We'll do about 25,000 this week and 30,000 next week. These are the current locations for our drive-through clinics where people can go. You can go to our website. COVID, we're using partnership with UMC. It's covidvaccine.umc.edu. They're helping us with scheduling. And you can schedule appointments right now for the following groups. If you're over 65, if you have underlying chronic medical conditions and are over 16, or if you are a healthcare worker. Those are the groups of folks who can get vaccinated right now. There's a lot of folks, there are over like 480,000 people who are over 65. And there are not that many vaccines that we've been given yet. So there is going to be a while to get people vaccinated in that age group. And that doesn't include the people with chronic medical conditions. We are going to expand to the number of clinics. We're starting a Hinds County location next week. We're hoping to add some in Scott County and Warren, Alcorn, Bolivar, and some other places. So stay tuned. There'll be more locations as we get more and more vaccine available to us. And that's all I have. I did want to just leave a good bit of time for questions and conversation. Anything y'all want to know about?
Thank you so much, Dr. Dobbs. That was wonderful. If any of you do have a question, if you will unmute your mic and you'll be able to ask it, or if you want, you could type it in the chat and I'll ask your question for you.
Yes, Dr. Dobbs. Just wondering about the daycare workers. Is they classified as essential workers, or when will the vaccine be available for the staff at daycare facilities?
That is a great question. And our initial plan was to probably have it available about now, but but we have ripped up the playbook. Apparently the feds have changed their guidance, and we've moved from essential workers to vulnerable people, which is understandable, but I just wish they had told us that to begin with, because we did all of our planning and gave you guys expectations that it was going to be available soon. It'll, within the essential workforce, you guys are at the front of the line, right? So our plan would be with like policemen, firemen, teachers, and you guys would be in that sort of teacher cohort. Anybody who's working in daycare would be eligible as the first tier of essential workers. But that'll probably, it may be a month or several weeks before that's activated, just based on the situation we're in right now.
Okay, and I also noticed that, like for Simpson County, we was on that drafted chart that you were saying that we was in the Central District, District 5. Mm-hmm. If there's a site set up where they will be giving tests at for the 5 district, or would it go to your local health department? Yeah, I'm in Simpson County in District here 5.
Well, I'll tell you, in McGee, the hospital there has got a real good program of giving vaccines. So I don't know that we'll have a drive-through in Simpson, but we're going to give more and more vaccine to the doctors and hospitals there. We've already given a good, I think to McGee, we've already given about, I don't know, 500 doses, which per capita is kind of good. I mean, it's not a ton, but it's good. So there will be ongoing availability to get it. At least we're trying to do it not only through the drive-thrus, but also through community health centers, private clinics, and pretty soon pharmacies. So there will be some local sites soon. A lot of it just depends upon demand.
We've had a couple of questions come into the chat. One is, Harrison County is out of the vaccine. When will Harrison County have more vaccine?
Right. So they're out of appointments for vaccine, right? So so they do, well, we do have vaccine coming, but all the appointments for vaccine that we have forecasted are filled. And so we've got, a few thousand people scheduled to get vaccinated over the next 2 weeks in Harrison County. If we get more vaccine, we would like to share some with, Gulfport Memorial's done a real good job, and also Coastal Family Health. Coastal Family probably still does have vaccine available if you want to call those guys. And I don't know about Gulfport Memorial, but they've been doing drive-throughs. So it's going to be a balance between our clinics and also our partner clinics.
Is the vaccine FDA approved?
It has an emergency use authorization, which is different than FDA approval. It's kind of like an expedited safety review. So a lot of things do come through EUA, especially now, just because things go fast. So it's basically just more streamlined paperwork stuff, but it is approved under emergency use authorization.
Many people were unable to make appointments in the past several days. The website crashed, and then it was announced that no more doses were available, and then a press release last night said 52,000 more doses had been secured. Could you clarify the status?
Well, and doses and appointments. So there are no additional doses for appointments over the next 2 weeks right now. So there are 52,000 more people who will get vaccinated, but there won't be more than that right now. So it's additional people who want appointments can't get them at the drive-thrus at this moment. But if we get some more vaccine in, if the federal government gives us more, we'll open up appointments.
Can you choose which vaccine?
Right now, you can't. It's one or the other. We don't have the capacity to do it through the drive-thrus. It may well be that You know, most of the private doctors are getting the Moderna because it's easier to handle. But that's not really something that is a choice. And we feel pretty comfortable that they're both pretty equivalent in efficacy and side effects. So, you know, I took the Pfizer, my wife got the Moderna. You know, we feel good about both of them.
If a person has had COVID, should they
Had
take the vaccine?
Oh, okay. I hope that.
When it's your turn to get it, especially if you're vulnerable, we do recommend you get the vaccine. CDC says you can wait up to 90 days because you will probably have some good strong residual immunity from your initial infection. But if you want to go ahead and get the vaccine for extra protection and maybe be protected longer, you should wait at least probably a couple weeks after you get sick and make sure that you're over all your symptoms before you get a vaccine.
After you're fully vaccinated, do you still need to quarantine if you become in contact with a person who is COVID positive?
Probably not. We don't have official guidance on that, but we do need to release it. I suspect that it'll be just like if you've had it before. It's for 90 days, and I think that's probably, if CDC doesn't come up with some definitive guidelines soon, we'll probably adopt the 90-day standard.
Can someone who has had both vaccines begin to travel or be around others without masks?
We do still recommend masks, and there's a couple of reasons for that. There still is a small chance of getting infected, so that's one of it. The other reason is we don't know for sure that you couldn't get a mild case and still be infectious, right? We know it keeps you from getting sick, but we don't know 100% that it keeps you from getting it and passing it on to other people.
Should people who get the vaccine and have to get 2 doses track for when they return to get the second dose?
Yes. And you'll be given a card that says, I'll show you my card. Okay. Where's my little card? Oh, I put it in my drawer. There you go. So you get a card, and it'll tell you what kind of vaccine you got and when you're supposed to come back. Then you document your second dose. So there's a piece of paper. There's also a computer thing in the appointment schedule that it'll give you an email or a text reminder when it's time to come back, or even a phone message. That's through the health department stuff, but you know, individual doctors will do their own follow-up mechanisms like they normally would.
How long is it projected to last once a person gets the vaccine?
It's looking pretty good. We think it'll last at least a year, maybe longer.
Come get the mail.
This question is asking about an air purifier. Would you address the air purifier, the effectiveness regarding protection from the virus?
I haven't looked at it within the past few weeks, but when we'd seen before, there really was no data. Is it bad? No. Does it help? Maybe. So I don't discourage folks from doing it, but one of the main things is to make sure you have good airflow. Make sure your air handling systems are good and you're circulating air properly and your filters are clean and that sort of stuff.
The virus has been mutating. Will the vaccine work against the mutating COVID virus?
It will right now. The strains that they've seen that are more contagious do seem to be covered with the vaccine. But will it mutate in the future where we would need another vaccine? That's a big unknown. So, you know, hopefully if we do a combination of prevention through masks and stuff, and if we get the vaccine, and since there's not enough around to increase the likelihood of mutation, we'll be in a lot better shape.
Why is no vaccine being distributed through home health agencies to bedridden and patients with no transportation and mobility issues?
You know, that might be something down the road, but the way it is right now, there's some real challenging logistic issues. So one of them is the Pfizer vaccine has to be minus 70 degrees until you thaw it out. And then it has 6 doses in it that are only good for a few hours. So there's not a way to assure that you would get full utilization out of it. And the Moderna, which doesn't have to be as cold, has 11 doses. And you only have a few hours. And so you can see how it would go bad really quickly. So that's not a That's not something we've licked. I think that if we can get to single dose vials pretty soon or single dose units, that would make it a lot easier. But we definitely want to do healthcare folks who go in and out of the home, right? And those are folks who can get it now, and we strongly encourage them to get it now.
This is a follow-up to the tracking question for the second dose. Should people attempt to schedule 2 appointments through the website?
Yeah, yes. And it is available now. So get your first dose, and then you can go ahead and try. But if it's not open that day, we're still just trying to figure out which guard troops we're going to have where. So, we're moving people around all the time like a chessboard. But there will be, and I went and checked today, and I did some sort of pretending like I'd already had it before. And you put in the day that you've had the vaccine, and it'll give you some sites you can go. You can click the location, and you can choose your days. For your second dose, don't be fixated if it's not precisely 21 days or 28 days. It doesn't have to be exactly 3 or 4 weeks. Pfizer's 3 weeks and Moderna's 4 weeks. It can be a few days after I took my second Pfizer dose, about 3 days late, just because we had an event here at the office, and it will work. It doesn't have to be precisely within those days. You don't want to be too far forward. You got 3 or 4 days before your scheduled date, but would encourage most people to wait until the date or a little bit thereafter.
Do you have to have an appointment to go through the drive-through opportunities, or can you just show up and go through the drive-through to get a vaccine?
No, please don't show up. You got to get an appointment. Yeah, got to get an appointment.
When the vaccines go bad because of them not being handled properly with the temperature consistency, what effect does that have on the overall vaccination for the public?
We've only lost 100. Well, we've lost a few bottles. There was a doctor who had a freezer that went out over the weekend and lost. So other than that one incident, we haven't lost any that I'm aware of. So it's just important to be careful. Will it happen? I'm sure that it will. I mean, they had a weather event and knocked out their power. They didn't have a generator. So those things are going to happen, but it's been a minuscule part of our response so far.
One more question. After the first vaccine, do you re-register for the second?
Your information will already be in the system, but you need to get a second appointment if you go through the website. Now, your doctor may do it differently. You can it's just like normally get like your flu shot or something. Just imagine getting 2 flu shots.
What about when the dosage is cut in half so that more people can be served? Does that lessen the effectiveness?
There is a hint of evidence that for young, healthy people, you could do that, but it hasn't been studied thoroughly, and FDA does not have confidence that it's going to be effective enough, so we're not doing that right now.
Do you have a time estimate for when child care workers will be able to get the vaccine?
3 to 4 weeks. That's a guess. I just don't know. A lot of it just depends on demand and supply, and those are both factors which we don't have clear visibility on.
Is there any particular strategy for making the vaccine specifically available for child care center staff?
Other than including in that tier, in more and more locations, I wouldn't anticipate that we're going to have like mobile stuff at the centers. It's just not really logistically possible to organize that way. But what we will like to do as we go forward is not only have the drive-throughs, but have doctors' offices, pharmacies, all that sort of thing where you can go. So we'll just try to create multiple opportunities for vaccination at multiple times a day, not just 9 to 5 on Monday through Friday.
Is there a cost for the vaccine?
There's not a cost for the vaccine. They may charge your insurance for the fee of sticking it in you, right? And so there's a thing called vaccine administration fee, and for Medicare, people would get like $28 from Medicare. Now we don't charge anything at the health department. It's totally free. Some private clinics probably would charge your insurance because they have to recoup their costs. If you don't have insurance, we can't guarantee that you wouldn't get charged the administration fee. Although some places will send that bill to the federal government, because the federal government will reimburse people who don't have insurance, even for that $30 fee.
Should a patient who is diagnosed with COVID shortly after the first dose still receive the second dose?
Yes, yes. You may want to wait a little while, but yeah, currently, and we've seen that before. We've seen that somewhat. Mostly what I've seen is, um, and I've actually seen a lot, I guess just because we had so much COVID recently, someone was probably incubating it and didn't know it while they got the vaccine, and then they were getting sick before the vaccine took effect.
Right now, the vaccine is voluntary. Do you think vaccination will move to being mandatory?
It's hard to say. I doubt it right now. The only group that I would almost say it needs to be mandatory in is workers in long-term care settings, because the mortality rate's just so high there. It's not even approved for kids yet, so um, and we're still early in this, so I don't have any visibility of that happening.
Are there long-term studies being done on the efficacy of the vaccines?
Yes, they're going to continue to follow folks for a long time who were enrolled, both for safety and also for effectiveness.
Do you expect to see a decline in cases? And if so, when do you think that might happen?
Well, we're probably already starting to see a decline in cases because we had a ton of cases right after Christmas and New Year's. So, we're still reporting, almost 2,000 cases a day, but that's not like 3,000, right? We're through a few hundred. So I think we're moderating a little bit. I don't think that's so much because of the vaccine, obviously. I think it's just because we're really bad about holidays, and that the holidays have sort of evaporated. So I think it's just the post-holiday effect.
If you work in Mississippi but live in Alabama, can you get the vaccine in Mississippi?
So if you work in Mississippi but live in Alabama,
Right.
If you're in a qualified group and you're working in Mississippi, I don't think that we would turn you away.
How long does it take the vaccine to take effect?
About a week. And so after your first dose, about a week later, we think you have maybe upward to 80% of effectiveness. And then after the second dose, another week after that, we think it's about when you get to about 95% effectiveness.
Does the second dose have to be the same vaccine as the first?
It does. It has to be the same one right now, either Pfizer or Moderna.
Who do you call for an appointment in McGee?
I don't know. The hospital had some, and I'm trying to. I'll see if I can figure out how much they got. I have like spreadsheets all over the place. Let's see, where's Simpson County? Simpson General. Well, they only got 300 doses. They may have used up those already. I don't know. I know they'll probably want some more. Let's see if they've got anything in McGee different. With Simpson General, now McGee General got about 700. So if you call, maybe I don't know if the hospital. If I'd go to the hospital website and see what they have first, and then maybe call and just see if they're still offering vaccine.
I believe you've already answered this question, but it came up again. Do you have a choice of which vaccine you take?
No, not at this time.
Okay. Are you still feeling good about the lack of cases in kids in schools and daycares?
Well, I don't feel good about the schools at all. We're still having a lot of struggles with those guys. We feel good about classroom instruction. We don't feel good about extracurricular activities because we see tons of outbreaks. And that's where the vulnerability is. It's a little bit different in childcare settings, but y'all have done great. We haven't seen a lot of operational impediments because y'all been able to do a good job of preventing outbreaks.
What if you don't get the second vaccine when recommended? Do you have to start the series over again?
Right now, no. There is no recommended upper limit on, like if you took it and you took it like say 2 months later, I suspect we would say that you don't need another dose, but also suspect that the guidance is going to change over time as we get more information.
Could you restate what you had to say about having to quarantine if being exposed to someone positive for COVID after you've received the vaccine?
Yeah, we would anticipate, and we haven't put out clear guidance on this, but we will need to, certainly as more people are vaccinated, that you would not need to do a quarantine after exposure after you're fully immunized. Kind of like if you'd been infected before. I think it'd be similar to that.
Do you believe there may be another shutdown in Mississippi?
No, I think that's gone. If we were going to do a shutdown, we should have done it in December.
Is the quarantine for 10 days or 14 days?
Well, that is a good question, and it's a complicated answer. It's 14 days is recommended, but if you feel perfectly great at day 10, CDC says that you can come off quarantine. Or if you feel great at day 7 but have a negative test, a PCR test, we say, then you can come off quarantine.
All right. Will the mask mandates and limited capacity hours in restaurants be extended past tomorrow?
I think what's going to happen is that the governor is going to go back to, I mean, this is just me reading the tea leaves, but I think he's going to adjust it based on how many cases there are within each county.
Those are all the questions that we got in the chat box.
Oh, great. Well,
Yeah.
thank you all for having me.
Thank you so much for giving us this time and answering our questions. We're so grateful to you for the leadership on helping our state in this terrible time, and all that you've done to protect public health. Thank you so much.
No, thank you. And thank y'all for the wonderful job y'all have done making sure we can take care of our state's kids. Keep up the great work.
All right.
Thanks,
Thank you,
y'all.
Dr. Dobbs. I believe you're doing an excellent job.
Thank you. Well, we're working hard, I promise.
Yes, sir.
Thanks, y'all.
Thanks, everyone.
Bye-bye,
Thanks
y'all.
for joining us.
Good.